Key terms for Unit 9 in Nutrition, Martha Olson. Starch is a form of a carbohydrate. We think of some of the foods being starchier than others. Potatoes and rice are a couple of foods that tend to be very high in starch. They stick to your ribs. In the American society, many of our starchy products are the fillers, the part that is cheaper to add into a meal or a diet to help you feel full. Complex carbohydrates are beneficial because they help lower or keep the blood sugar more consistent. It's two or more monosaccharides. Your simple sugars are your glucose, and those are not as healthy for the person because they're just a sugar. Our disaccharide is two monosaccharides that are linked together. Di means two and mono means one, and so your monosaccharide is a simple or singular sugar unit. Poly means many, and so a polysaccharide is 10 or more of the sugar molecules, where aglio is the prefix for scanty, and an agliosaccharide then is only 3 to 10 of the linking molecules. Glycemic index is important for the diabetic. It's the amount of effect that a food has on a blood sugar after it's eaten. So if I would eat white rice at a meal, the glycemic index is very high for white rice, and my blood sugar will spike very quickly after eating that and then fall, whereas your complex carbohydrates have a lower glycemic index and their blood sugar maintains a steadier or a more consistent effect on the blood sugar. So we want to avoid any foods that have a high glycemic index. Bran is that outer protective coat to that grain kernel, and this is where the fiber is from. So when we look at foods that are high in bran, we know that you're getting more fiber. Our other terms that go along then with the grain, the husk is that outside, or chaff is the other name. Endo means within, and your endosperm is the inner or middle portion of that is the starchy part. And then the germ is the innermost part that is the rich in proteins, oils, vitamins, and minerals. Our total fiber then is both dietary and functional fiber. When we look at functional fiber, we know that's non-digestible and it's beneficial to humans. Then when we have dietary fiber, we also know that that's found naturally in plants. It's non-digestible in the small intestine. Pectins are fibers that are found in fruits, and you might think of that in the fall when we do some canning. They talk about the fruits in that, getting the pectins. Glucose is a monosaccharide that's very common. It's our sucrose, lactose, and maltose, and various complex carbohydrates. Also, glucose is present in the blood, known as dextrose, and we look at like a blood glucose level. Also, the other term for this is sugar. Fructose is found in honey and many fruits, and our galactose then is a monosaccharide that's very similar to our glucose. You'll hear of lactose, which is glucose and galactose. The other name for lactose is milk sugar. When you hear of people that are lactose intolerant, they can't have the milk or the dairy products in their diet because they are not able to break it down. Sucrose is your table sugar. It's a disaccharide that's glucose and fructose, so it's a little bit of this sugar from fruits. And then your maltose is two glucose molecules, also called malt sugar. It occurs naturally in many foods. Alpha bonds are chemical bonds that link the monosaccharides. They're broken by intestinal enzymes, and remember those enzymes will end in ASE, and the releasing of that then makes monosaccharides, or breaks them down to one single units. Starch, maltose, and sucrose contain these. When we look at pancreatic amylase, that is the starch digesting enzyme that's secreted or made in the pancreas. When we look at amylase, we know that it helps to break down ASE. It's an enzyme. Epinephrine is another term that we'll be using in this unit. It's a hormone made by the body. It's released when a person is stressed, or the fight or flight that you might hear about. It raises blood glucose levels. So people that are under a lot of stress might have higher blood sugar levels or glucose levels as a result of the stress causing the epinephrine to be made by the adrenal gland. Ketosis is another term. It's usually related to ketone bodies, a high concentration of ketone bodies. These are formed from fat when the body doesn't have enough of the carbohydrates to make glucose to use for energy. The body then goes to the fat and takes the adipose tissue and breaks that down, and the byproduct of that is ketone bodies. And we check for ketones in the urine when we look at a person that's in ketosis or ketoacidosis. It's a very serious health condition that needs to be treated in the ER, and usually those patients are admitted as well because of the very serious effects of ketoacidosis, usually again with your diabetic. Dental caries is usually the breaking down, destruction of the enamel surface of the teeth. I have a picture of a baby at the top with a bottle because children that are put to bed with milk or formula will have that natural sugar that stays around their teeth all night, and it breaks down the enamel of the teeth, causing the picture at the bottom, which is called dental caries or baby bottle tooth. Our nutritive sweeteners are things that make food sweet, and they're absorbed and yield energy in the body. These substances impart sweetness to food, and many of them have no energy at all. So these are our non-nutritive sweeteners, things that are in your Diet Pop or Diet Jello, any of those type of products. Examples of these, asulfame K is an artificial sweetener that's about 200 times sweeter than your table sugar, and yet it gives you no calories but no energy. Aspartame is found in many of our Diet Pops. It's an artificial sweetener. It has 2 amino acids. There are many people that find out that they have kind of an intolerance to aspartame. They will drink a Diet Pop and they will have a headache or get a migraine headache, not feel good, and as soon as they eliminate all of the sweetener from the diet that's artificial, they don't have those complications anymore. Another one is called neotame. We have sucralose, which is 600 times sweeter than just your table sugar, so it doesn't take very much. Many of your diabetics will use some of these artificial sweetener products in their baking and cooking, and you'll find them in the aisle with the baked goods. Saccharin has been on the market probably the longest, and it has been linked with cancer in rats and mice, although there's a lot of research that was done for a long time on that to see if it caused cancer in humans, but it was never fully, related with that. Diabetes mellitus, there are 3 types that a person can have. It's a chronic disease. Type 2 is your typical older person that gets a type 2, overweight person. They are treated with the oral medications. Type 2 is also very much genetic or down through the family history. Gestational is when you're pregnant, and some of those women after pregnancy will continue being a diabetic as a result of that. And when you have gestational diabetes, your treatment is insulin shots or injections. And then the type 1 is a younger person that has a damage of some form to the alpha or beta cells of the pancreas, and they do not make enough insulin to support their body. So when we look at type 1, it's the most serious because it's more of a roller coaster with the blood sugars being up and down, and the immune system for some reason has attacked the pancreas, causing then the cells to have an inability to make insulin. I have seen this in people that had like an overwhelming infection or a viral infection, and it seems to kind of damage the pancreas as a result. Type 2 is more of your inability to respond to the insulin that your body makes. Either the person is overweight and the amount of insulin made to support an obese person is not enough, or the insulin has kind of gotten lazy and it doesn't work as effectively to open up the cells to get in and have an effect on lowering that blood sugar. Our blood sugars then, if it's abnormally high, it's called hyperglycemia, and that would be treated with insulin. And a patient that's very, very low would be called hypoglycemia. And a normal blood sugar is about 70 to 110 fasting. So anything below 70 is considered hypoglycemia, and anything above about 128 or so is considered hyperglycemia. Treatment is exactly opposite for these, and if you had a choice, typically your hypoglycemia is a more serious condition because people can die from being hypoglycemic. And then we look at two other things made in the pancreas. One is glucagon. It promotes the breakdown of liver glycogen to glucose, so it will increase the blood glucose levels, and we can give an IV form of glucagon or dextrose into the bloodstream if a patient is hypoglycemic. And insulin does the opposite. Insulin stimulates the uptake of the blood glucose into the cells, the formation of glycogen in the liver, and various other processes. And with insulin, then it makes the blood sugar become lower. That's the end of our key terms for Unit 9. I hope this was helpful to prepare you for the reading and the lectures that we will be having.